welcome to Murphy Deming Physical Therapy. How are you today?
I'm good. I'm here for my first appointment. My name's Riley.
Okay, well, we have this form for you to fill out and then we'll take you back, all right?
Great, thank you.
All right.
Yep, I got it.
You can go sit in the waiting room over there.
Okay.
Oh, yes, I can't really write. I'm gonna fill it out. Yes, okay. Should we retake this? All right, here's your new patient's form.
Thank you, Emily. Hey Caroline. So we have a new patient. Would you mind co-treating with me with this one?
Yeah, of course.
Okay.
What do we got?
So we have a patient named Riley. She is 4 weeks post CBA.
Okay.
Seems like the right side is
Affected.
Yeah.
Yeah.
Left leg, right leg is dragging a little bit.
Yeah. Page 40. Okay, you can see they identify as non-binary, so they'll use they, them, their pronouns.
Okay. I'm gonna be completely transparent with you.
Yeah.
That subject is a little new for me, and I'm a little uncomfortable of approaching how to treat. Do you have any recommendations on how we should go in there?
Yeah, of course. This is a topic that's like really uncomfortable for a lot of people in our field, so just know that you're not alone with that.
Okay.
So we can see on the paper that they identify as non-binary, so they'll use they, them, their pronouns.
Okay.
So they don't identify as male or female specifically.
Okay.
So when we approach them, we can try to just call them Riley and stick to the name so that they feel more comfortable.
Okay.
Okay. Hi, are you Riley?
I am.
Perfect. I'm Caroline Quigley, and I'll be your occupational therapist for today.
My name is Aria Jones. I'll be your physical therapist for today.
Would you like to come back to the room with us?
Sure. Can my partner come with me?
Of course, if that makes you comfortable.
All right, thank you.
So we understand that you were in acute care for some time. Was there anything that you did there that you really liked or really didn't like and wanted to keep doing?
We really just worked on getting me up and out of bed and learning how to walk with the cane properly. I wish I had more energy to walk farther, but that was about it.
Yeah.
Okay. Being that this is your first session in outpatient, are there any goals that you have looking forward to? Any concerns? Do you have anything that you're worried about, or anything of that nature that might be beneficial to your recovery?
Yeah, I noticed I'm a lot more tired than I was before my stroke. I also really fear of having another stroke as well. I also just don't feel attractive anymore based off my arm, my leg, they're just not functioning right.
Yeah.
And I'm just worried they aren't moving around the house as much as usual. They're not being very physical, and I think it might be related to their fears about having another stroke.
Okay. Yeah. Do you have any other concerns that you want to share with us before we get started?
I'm not really sure if this is a topic I can have with you guys, but I'm my biggest fear is really having a stroke during sexual activity. I'm not really sure if that's a safe thing for me to do.
Yeah. Well, first we wanted to just acknowledge how brave of you it is to come out and speak about your concerns, especially regarding something like that. We can assure you that it is a part of both of our fields of practice, and we'll do everything we can to assist you in reaching your personal goals.
All right, thank you.
And this is seems to be a private conversation, so would you like to go to a more secluded room? Would that make you more comfortable?
Yeah.
Okay, perfect.
Okay, Riley, thank you for expressing those concerns that you have. It's very normal that you have these concerns, and I want you to validate that what you're feeling is appropriate, okay? As a physical therapist, the first thing that I want to emphasize on is function. Your partner did mention that you do not move around the house as much as you used to. I would encourage you to start doing things as you can, within limits of course, but moving around as much as possible, okay? To try to get a little bit of that function back, and that will make you feel more confident in like moving forward with the situation that you're currently in, okay? And as Riley's partner, I want to emphasize helping when Riley wants help, but allowing them to do as much as they can, okay?
And for the OT aspect, we're going to focus on your concerns with your fatigue. So focusing on fatigue management. We can do this by working on like endurance, especially when you're engaging in occupations like ADLs, IADLs, and just improving your independence with those. Yeah, so does that sound okay for you?
Sounds good.
Perfect.
And also, so what I can do now is I can go get some resources for you that I think will be beneficial for the both of you guys, and then Caroline is gonna proceed forward and starting some treatment with her, okay?
Thank you.
Thank you.
Let's get started.
All right, let's go.
Okay, I'm gonna be completely transparent and honest with you. I'm not extremely comfortable with the topic. How would you recommend us going about treating Riley?
Yeah. Well, we learned in school about this thing called the PLISSIT model, which stands for permission, limited information, specific suggestions, and intensive therapy. So first, we would need to gain permission from Riley to discuss their sexuality.
Okay.
And then we're going to provide facts on how their disability increases or impacts their sexuality.
Okay.
We can then offer them suggestions that may allow them to engage in sexual activity again. And then depending on severity of the impact, we may need to recommend them to a professional specially trained in this subject, but
Okay.
we'll get to that when we get there. There's also, we learned about two models of disability, the social and the medical. For this, I would recommend we focus more on the social model, which basically views disability as a part of the human experience and focuses on enhancing quality of life. So I think you should take this approach with Riley.
That sounds good to me. First, I want to thank you for helping me with that situation.
Yeah,
That's
of course.
very new for me. I think we should probably talk to our boss and administration about installing some like workplace training.
Yeah,
so
that would be
everyone
awesome.
feels a little confident going
Yeah.
into that situation.
It's definitely needed in like both of our practice fields. So
Yeah.
I think that would be a great idea.
Okay, cool.
Of course.
Thank you.
We'll provide facts about how her
Okay, Caroline. So she brought she.
Let's go.
Scene.